Tinnitus is one of these, a bit of a tricky one. The most important thing is protection, but if you do experience tinnitus, come and see an audiologist effectively.
Yeah.
There's a few things that we talk about. We'll do a few assessments just to understand the degree of tinnitus, how bad your experience of tinnitus is compared to somebody else's.
Yeah.
But also we'll have a look in the ear, we'll stick the camera in there. Sometimes it can just be wax build-up, so that sort of thing. But we'd always do a hearing assessment as well, just to check. Sometimes when you have a hearing loss associated with tinnitus, correcting the hearing loss can help reduce or remove the tinnitus completely.